Well, let's begin today. Actually, so today and tomorrow, we're going to begin each program by hearing from ADTKD patients about their experience with this disease and their efforts to find a diagnosis. So to kick us off, I would like to introduce ADTKD patient, RKDF volunteer, and registered nurse, Vonnie, who will share her diagnostic journey and how she was finally able to get genetic testing. And remember, if you have questions for Vonnie or any of our panelists, please type them in the Q&A box. Thanks for joining us, Vonnie.
Hi, thank you, Sharon. Thank you for having me, and I appreciate all of you for taking the time today to listen. We really appreciate it. Just to start off, both my parents passed away on dialysis. My mom was diagnosed with chronic kidney disease at 52 years of age, and my father in his 80s. So at first, my mom was told that she had polycystic kidney disease, and my father was told he had uncontrolled blood pressure and renal artery stenosis. So then when I was in college, I was tested for polycystic kidney disease and I was told I didn't have it. So, I went along my merry way until about 2019, I had lab works come back. And my EGFR was 72, which is still above normal. But I was like, oh, that's a little strange. Like, I'm a pretty healthy person. So I talked to my primary care doctor and he ordered lots of labs and a renal and vascular ultrasound. And everything looked good. I had like one tiny cyst. He's like, I don't think you have polycystic kidney disease. So of course I just, went about my merry way again. And then in 2022, after seeing more recent lab work where my EGFR continued to decline while my creatinine increased, I started getting a little bit nervous. So I took it upon myself to schedule an appointment with a nephrologist. Very nice doctor, ordered tons of labs, more ultrasounds, and he was thinking that maybe it was because I was severely anemic with borderline hypertension. So he added medication, come back in 6 months. So unfortunately, he left the office and moved to a different state. So they switched me over to a new provider who was very nice, but he was very focused on blood pressure and getting a biopsy. And so I even had one scheduled, but I canceled it a few days before because I was very concerned with complications as I've had like bleeding issues in the past. And so at this point, I start getting super neurotic and checking my BP, which like numerous times a day. Many times, I had told these doctors, both my parents were on dialysis. I really want to avoid that. So moving forward to this past summer, my numbers are still decreasing. I'm getting tired all the time. I'm like, gosh, this is so strange. And they just keep saying, come back in 6 months. I'm like, okay. So I work at university hospitals in Cleveland. So I asked one of my doctors who also has kidney issues, and he said, I know the perfect doctor for you. And so I had to wait 6 months to get an appointment with her, which just brings us to this past January. So this whole thing started in 2019, and now we're in 2025. So she was a wonderful doctor. She really listened to my concerns. And the first thing she said was, we need to do genetic testing. And I was like, oh my gosh, I've asked about that, but they just kind of were like, we need a biopsy. We need a biopsy. And I was like, I really don't want to do a biopsy. Anyway, so she had the box for me to take home. And I completed and mailed the kit the next day. So 3 weeks later, I finally had the diagnosis of UMON. So I pretty much read every single article written, and thankfully I found the Rare Kidney Disease Foundation, and Rich and Sharon have been wonderful. And it's not the result that I was hoping for, but I'm glad I finally have a diagnosis and an amazing resource from the RKDF. So I look forward to volunteering my time and helping others in my shoes. And really, I want like nephrologists to understand like genetic testing. Like my insurance covered it. I didn't pay anything. And then I wondered throughout this whole why not one doctor mentioned genetic testing with both of my parents having kidney disease. So I calculated a couple days ago. But since 2019, I have spent almost $20,000 in lab work, ultrasounds, and appointments with specialists when maybe I could have been tested and just known and then like prepared myself.
Oh, Bonnie, thank you for sharing your journey and that you can still have a smile on your face. Uh, I'm just really impressed and thank you for joining us today.
Yes, thank
Um, Stick with us. We do have some questions for you, but next I'd like to introduce Angela Watt. Angela is a retired renal nurse and a trustee with Kidney Research UK, the largest charity in the UK that funds research focused on the prevention, treatment, and management of kidney disease. Angela is also a UMOD patient. Thanks for joining us, Angela.
Thank you very much. And good morning, everybody. Good afternoon from the other side of the pond. Thank you for inviting me to speak to you today to talk about mine and my family's journey with kidney disease. So I can trace the kidney disease in my family over 5 generations. I know that my great-grandmother died of uremia and nephritis in the 1930s before dialysis was an option. My grandmother and her sister both had kidney failure and had transplants, one successful, one not successful. My own mother developed kidney failure in 2000, so I knew it ran in the family, but we never had a diagnosis. And then in 2006, my youngest son, who was a year old, was diagnosed with CKD. So that was the point when I realized I wasn't going to escape it. It was probably coming my way at some point, but we still didn't have a diagnosis. And it was only in around 2014 when I was eventually diagnosed with CKD that we ended up in the system, and I met with Professor John Sear, who is on the call, who I think you might be going to hear from at some point today. And luckily, John is a nephrologist at my local hospital who specializes in inherited kidney diseases. So he was the one who got the genetic testing done on myself and my son. Originally, it was through a project here in the UK called the 100,000 Genomes Project, which looked to map the genomes of 100,000 people with rare diseases where they didn't have a genetic diagnosis. And actually, they didn't find anything in it. They came back saying they couldn't find anything. And it was John himself who found it. He got the raw data back and had a look. And it was during the first lockdown, right at the height of COVID, he messaged me and said, I found something, I need to speak to you. And that was the first time I heard about ADTKD and UMOD, which is the mutation in our family. So since then, I have now developed CKD. I am now just about to start on dialysis myself. My son has had a successful transplant from my husband. He's doing really well. I have 2 other children. They have both been tested and they both do carry the gene. So the 50-50 doesn't work in our family. All 3 of my children have got it. And we have also found other family members. My brother carries the gene. He's now got CKD. My great auntie, we knew had family. I was in contact with one of her children. And he carried the gene, although he didn't have the CKD. He had the juvenile gout that you get. But his daughter carries the gene and she has CKD without the gout. So Holly Mabillard, again, who you're going to hear from today, is doing a lot of work into that, why there's that genetic difference within our family. Very briefly, by background, I'm also a nurse. I actually spent 20 years working as a kidney nurse. Probably the family history that made me have an interest in kidney disease, predominantly working in the hemodialysis setting. But in the last few years, I worked as a specialist nurse here in the UK for patients with another genetically inherited rare kidney disease called aHUS. And I've seen their journey and the journey we want to be on, where they started out with just a genetic diagnosis and now they have a treatment for it. That has stopped the kidney failure in their families and allows people to have transplants and things like that. And I've seen the difference it makes to them. And I want that for future generations of my family as well. So thank you. I'm looking forward to hearing what everybody's got to say today.
Thank you so much, Angela, for sharing your story as well. Let's see, Kathy, do we have questions for Angela or Vonnie?
Yes, we have a question for Vonnie from Tim. He wanted to know why you didn't want the biopsy.
Increased risk of bleeding complications. I had 2 other surgeries where I did have complications, and biopsies are not, there is risk involved to them. And even when you sign the consent, it says you may die. And I was like, I don't want to spend a week in the ICU with the bleeding complication. And that's one thing I feel that they don't really tell you. And there are a lot of biopsies that go extremely well, 99% of them. But there is the 1% that do have complications, and it also increases more scarring in the kidneys.
And I think, as we know, the biopsy is not useful in determining whether or not you have ADTKD. So it was very smart that you didn't have the biopsy.
Right. Yes.
Yes. Then we have a question. I think it's from Dr. Sayer for Angela. Let me just read. I think he wanted to know if a biopsy was ever mentioned to you, Angela.
No, it wasn't really, but I don't know, maybe because I was still in the early stages of my CKD, I don't know if I had progressed further without a genetic diagnosis, whether at some point they might have said, we should do a biopsy to see if we can find out what's going on. I think once we had a genetic diagnosis, that was it, pretty much locked in, and there was no need for a biopsy.
And we have one more question from Kelly for Angela. She was just wondering, how old were your kids when they had the genetic testing done?
My elder two children were both adults, so over the age of 18, I can't say exactly what, but old enough to make the decision for themselves. My son was still a child when he was entered with me, but actually it turns out that he has two rare kidney diseases. So his actual kidney failure that he required the transplant for, I think, was probably due to he had a grade 4 reflux. And that's what caused his CKD. And then the ADTKD finding was another anomaly sort of thing. So he has both of them, but it's actually the reflux that caused his kidney failure.
Thank you. That's all the questions we have for now.
Thank you, Kathy. And I just want to mention that Dr. Say also put in a comment to us that he really favors the idea of genetic testing prior to biopsy, not only because it saves all the pain and expense, but I'm guessing it's because it's less invasive, it's more conclusive, and then as you mentioned, Kathy, you can't diagnose ADTKD with a biopsy. Only a genetic test will detect that. And I'm sure there are other kidney genetic diseases for which a biopsy won't tell you any more information. So it's fairly invasive as a diagnostic tool. In many cases, it's warranted. I'm not saying it's not, but even Dr. Sayer is suggesting probably genetic testing prior to biopsy. So thank you for that, Dr. Sayer. Okay, it's time to move on to our next session. Thank you so much, Vonnie and Angela.
Thank you.